don't have a very happy video. Sorry about that. We always want happiness for you, and our content we try to make it as entertaining as possible and not to talk about bad news or sad things. But I think that this video was needed because people need to be aware of this situation and also to prevent them themselves. So guys, remember that we told you that we were going to go to Tacloban for 4 days and 3 nights, but in the end we were not able to vlog as much. It's because of an emergency situation that happened here in Tacloban. We're actually shooting this from the hotel room. So the first night, after the buffet dinner, the food was not very well on my stomach, and I woke up around 4 a.m. and I was vomiting a lot, and I had like very liquidy discharge. So it happened, like the discharge happened 3 times, the vomiting happened 6 times, and by 7 a.m. I was feeling so dehydrated, so bad, and my stomach was hurting a lot. And that's when I realized that I had to go to the doctor because I was really bad. I tried drinking water, but everything I drank vomited again. So they took me, and by they I mean Luna, took me to a hospital that is here in the area. And the plan was to go to the emergency and use our insurance so we can,
use some medicine
yeah.
for what was happening to her.
Yeah, so apparently I had gastroenteritis. I don't know if it's the pronunciation. In Spanish is gastroenteritis. And I was very dehydrated. And in the emergency room, we insisted, I handed out my insurance, my ID, and they said, oh yes, they said they called the insurance and they said, yeah, yes, this is included, this hospital, and don't worry, we will take care of you. They started with drops, with IV, and
But before doing that, the doctor was saying like she wanted to admit you instead, because if you are just here in the emergency room, I'm just gonna give you some medicine and then you will just vomit the medicine right away. So it's better if you just get admitted at least for a day so they can keep you in observation.
yeah, so I was doubtful, but also I was really bad, and I just ended up saying, just do whatever you think is good for me to heal, because I just needed to heal. Like, I was really bad. And they started anyway with IV fluids there and all this stuff, and then they brought the papers for me to get admitted for 24 hours, so they said. And they said that this is covered by the insurance, blah blah blah.
Yeah.
They communicated
so
with the
first of all,
insurance.
we are only getting her admitted if the HMO will cover it. So that's why, because of this confirmation, we moved forward with that.
Yeah, and since we said, okay, it's just going to be 24 hours, and because they said for observation in case that you continue vomiting or diarrhea and whatever. So, okay, we got admitted. I got admitted. Because I am so used to talking in plural.
Yeah. Also, I was not free to go apparently.
Yeah, because they insisted that my sister had to stay with me all the time. So the doctor went to see me like only once, and he was just talking like asking generical question like, oh, how long have you been in the Philippines?
Yeah.
Like he was interviewing some tourists. and which we are
Not tourists.
essentially.
We are not tourists.
Well, we were touring here during in
Well, we were
Tacloban. That was
tourists
the
here in
plan.
Tacloban.
That was the plan, but like we were not able to do anything because all I did was had dinner and then got sick, and now I'm in a hospital admitted for 24 hours. So
Yeah.
I was not able to go out, right? So I had a discharge while admitted at the hospital, and it was still liquidy. So the doctor said that the only way that I was going to be discharged if it's my tool becomes hard again.
Hard.
So they started giving me some pills that would stop the diarrhea and also harden the stool, but
It just constipated you.
yeah, basically just block me. I haven't been able to go to the bathroom yet.
Really? Oh
Mm-mm.
wow. It may take around 3 days for that to work.
Yeah.
That's why I don't take medication like that.
Anyway, it's the next day already, like, and keep in mind that they've been constantly like medicating me and adding a lot of stuff, and I have an IV drip, and I have like two IV drips together, and
Because
like,
the second IV drip is medicine.
yeah,
It's an antibacterial.
bacteria, yeah, because they suspect that
It was a
it
bacteria.
was a bacterial gastroenteritis, so they had to give me that.
There was
So-
also medicine for the pain and medicine for other stuff that I don't remember.
So up to that, everything is great, everything is okay, because it's included by the insurance, everything that they're doing, right? So next day, I am feeling great, I'm feeling better, I'm not vomited, I haven't vomited since
Anymore,
I was admitted, and I haven't pooped because of the pills they were giving me. So I'm like, I'm already great. So since the doctor says 24 hours, I'm ready to get discharged. So because it's been 24 hours.
Or more. It was already more than
Yeah,
20.
I was admitted around 8 a.m.
No, 7:35.
7:35, and then it was already 8 and something, and they say, oh, you cannot be discharged because the doctor is not here.
Yeah. So,
So-
I just looked at in the eye of the head nurse and I told her, call the doctor.
Yeah.
Because it's a Sunday and I know that some doctors don't go in early. So just call
So
the
no, but before you said that, I asked like, oh, so when is the doctor coming? Oh, he's coming in the afternoon. So we were like, what do you mean? Because according to the discharge rules, they have many discharge rules. You are supposed to be discharged before 12 p.m.
Yeah.
So if he's coming in the afternoon, then I'm gonna miss my period, and they say like, oh, but you haven't pooped either, and that you had to poop, and I'm like, that's not relevant because like I'm fine already. Okay, I'm not vomiting, I'm not. So I just need to go because I'm here on vacation. I want to enjoy my vacation. I don't want to spend my vacation in a hospital room.
Moreover, we are leaving back to Manila.
Next day, like
So
literally our flights.
We cannot absolutely stay there.
Yeah, literally our flight is today, so that was yesterday. This what we're saying happened yesterday. So Luna was like, call the doctor. And then the nurse went and called the doctor, and then the nurse came back and said, oh, the doctor is now picking up the phone.
But I left him a message.
Ah, okay. They administered some more medicine on me, but I was already feeling uncomfortable because this was raising like so many red flags in my head already, because there is a common scam that starts exactly like this. So we were like, cannot be. Okay, let's continue. Let's see what's going on. Then the nurse goes and came back, and then she says, oh, unfortunately, since today is Sunday, the health insurance is not working today, So you will have to be discharged tomorrow. That is Monday.
And if you want to be discharged today, you will have to pay cash.
So that was like huge red flags. That's where it clicked what they were doing, you know. So I like we really cannot be discharged tomorrow because I have a flight. I'm not about to lose my flights to be on a hospital room just because you don't want to discharge me. No, it's not that we don't want. It's the doctor is not here. The health insurance is not working, and we're like, I haven't heard health insurance not working on Sunday. So we're like, we're gonna call the health insurance. Okay, then the nurse left, and then we were trying to contact the health insurance through their main line. They did not pick up, but then Luna found the phone number for the health insurance agent that works with our company.
Yeah, shout out to our managers that replied really quickly in a moment that we needed them. Thank you. You guys don't sleep. You guys are amazing, even in a Sunday answering work related questions.
Yeah.
Love you.
And then we got in contact with the health insurance, and then they tell us, oh, but this you are admitted at a hospital right now, and I'm like, yes, but this was not
Communicated to us.
yeah, like it was not approved. Like there's no approval in the insurance for the admission, and also there's no records of call from that hospital specifically that you were in emergency room and that you had been admitted or anything. So I'm like, oh, so they really did not call
They
the
didn't even call
insurance
the HMO.
because they were counting on us to pay this cash. So this is how the scam works. They say they will tell any random excuse for not calling your health insurance, and then they will charge you cash, and then will tell you, yes, you can refund that with your health insurance later.
Reimburse.
Yeah, you can just file for a reimburse. And then when you leave the hospital, they do file that with the health insurance. So they also charge the insurance, they charge you as well, and they have double payment. So I'm like, that's the scam. Okay, got it. So I talked to the agent, and I'm like, also they said that they call you guys, and they said this, but they actually did not call you, and now they are trying to charge us cash for all this. And then the agent was like, let me talk to the billing people. Because like we are ready, like we can pay you guys up to 185,000 pesos. Like there's no way that this is not covered, like this is covered. And like if they didn't file that yesterday, like if they have filed that yesterday, like no problem today. Right?
If they had contacted on Saturday to the HMO, because supposedly they tramit all that through their own HMO office, right? Which is open on Saturday but closed on Sundays. Then our HMO would have tramited the LOA, letter of authorization, on Saturday, and all of these could have been avoided.
Yeah, but they did not, because
They
they were
did not.
counting on us.
It was never
to
their intention.
pay cash.
It was
Yeah.
never their intention.
So she talked to the nurse that was like in my ward, I guess, and she was like telling her like, why you didn't file kahapon, you know. She was like fighting with the nurse, and the nurse was like, oh, sorry, because the doctor, blame someone else. Then when they talked to billing, people from billing were blaming our
She told me go talk to billing, right? So when I went, I didn't have the agent on the phone anymore, and I couldn't call her because I don't know your ID. I didn't have your ID on hands when I was downstairs. So the person in admissions was like, oh, it's because we don't do discharge of HMO on Sundays. And I was like, and why you didn't tell us this? Because yesterday we told you If our HMO covers it, then we will go forward with the admission. You know we have an HMO. We presented our ID. If you cannot discharge HMO on Sunday because that's your hospital rules, then you should have rejected the admission yesterday.
And just say, okay, we're going to treat you here in the emergency room and then
And
prescribe you this and this medicine. And
Or
that's it.
then letting you know that you should follow up with this other doctor later or something like that. So what he does is he blames our companion Sarah, like, no, because she agreed that you will pay cash and then just get a reimbursement. So I was like, what's the alternative? Because I'm not gonna pay no cash. You gotta solve this. We are living with our HMO covering this today. That's not possible, that's not possible, that's not possible. Find a way. Maybe we can just sign a promissory note or something. No, promissory notes are forbidden in the hospital. All right. So I'll go back up to call the insurance people again. So with Sol, I was calling, and they had escalated the case already when we called them back. With two, a supervisor or someone that works directly with the HMO and our company.
Yeah. So then they said, I already sent an email and I'm just waiting for them to give me the bill. Okay, so we were like, okay, they are communicating, they are solving this, right? Then the nurse comes in again and said, oh, the bill is already ready, go down.
Yeah.
So when we go to collect the bill, guess what they had for us? Not the bill.
They gave
An admissions paper for field health.
Yeah.
Field health, which is not like, it's the general, like for those who don't know, there's general insurance like for everyone here in the Philippines from the government, but this insurance don't cover like 100% of your bills in the hospital. So usually a Filipino will need to have field health plus another private insurance that will cover all the bills. So which is what we have, right? But then they were trying for me to sign field health admission papers, and I'm like, no, I'm not being admitted through field health.
Yeah. We are being
Because
admitted.
they want us, okay, so they are not gonna pay cash the full amount. At least if they sign with the field health paper, they will have to pay
The
a
difference,
difference, right? So I'm like, no, I'm not signing this. I'm not signing this. No, because you don't understand. And I'm like, you don't understand, lady. I go to the hospital and I don't pay 1 peso for anything because my health insurance covers 100%. And I show you my card and I show you my ID. And I told you, this is my health insurance and this is the health insurance that you are going to use. You're not going to use field health for me. No, because today is Sunday and the same stuff. And I'm like, but look, our agent already sent you an email so you can send them the bill. Send them the bill so they can send you the authorization and the approval and all this stuff. And that's it. No, because
They were not checking their email.
They were not. They
checking.
were.
Instead, they were giving me a paper that says their email address. Like, I need that. So I told the girl, the agent, to
again.
call me. And then she spoke with them. And they told, fit them the same lie that our companion agreed that we were going to pay cash and then get reimbursed by the HMO.
Yeah, I wish I told her that is not true. They are trying to say, you know, whatever
Yeah.
a story so that we can get charged for the bill when we already presented our health insurance on the first day and they said, yes, this is covered. We will call your insurance now, and they did not call the insurance, you know. So they were back and forth with the agent, and then the agent spoke to the
Head of the HMO office of the hospital
Yeah.
or clinic.
and then she got that we get discharged. But
Yeah.
before getting discharged, The person hands me the paper for field health again and said that I had to sign that, and I'm like, no, I don't have to sign that because again, I am not getting admitted through
You
field
said,
health.
I have a private insurance.
Yeah, I'm not getting admitted through field health. And she's like, oh, and then
She got frustrated, so expressive. Because we, with all of these guys, we were smiling. We were smiling.
I was at peace because I knew what they were doing. And now, like, they are trying to charge I Care, which is our health insurance, Field Care,
Field
Health, and
And
also us. So they were trying to charge 3 times. They were trying to make money 3 times for the same thing.
Well, she got frustrated, went back to the office, and then came back with the discharge papers.
Yeah.
She explained, give the blue to the nurse station in the
Then
sixth
the
floor,
white to the security
and the white
guard.
to the security guard in the basement.
Then when we went to the nurse station, they
Thank
gave
you
us
so
a
much.
prescription. Thank you, bye-bye. And then the
Bye-bye.
nurse said,
The nurse was like, that bitch.
uh-huh.
But I was already happy because we, like, the evil didn't win.
Yeah.
So we went to basement, gave the security guard the discharge paper, and went on
we
our
went.
way. Thank you, Po, to everybody. Ingat po, salamat, everything.
Yeah. Then when we realized, we saw the reviews of this hospital and we realized that they were doing this to other people,
Yeah.
to Filipino people that are sick, like they are taking advantage of vulnerable people who are sick and doing this scam
And
to
according
everyone.
to the reviews, they really inflate the bills. Like, there was a person that said that they owe at this point 146,000 pesos. So, which is wild. And also, I was reading the rules, and the hospital has so many ridiculous rules. Like, if your bill is over 70,000, you have to pay cash. You cannot pay card or insurance or anything else.
And
Listen.
also, like, if you are going to
Sue them.
sue the hospital, you have to pay them their lawyer.
You have to pay a 25% of
Of
their
the
lawyer
lawyer.
fees,
That's
or 1,000
Crazy.
pesos, whatever is greater. Which means if their lawyer fee is less than 1,000 pesos, you have to pay 1,000 pesos. Or if it's way more than 25% of the lawyer fee, then you will pay the 25%.
It's just
Which is
crazy.
wild. Those are wild, arbitrary rules the hospital enforce themselves to just take advantage of poor patients that are, I mean,
Suffering that
Suffering in illness,
you
and
know,
you do
thinking that
this
they
to
are going to
people.
get some treatment and that they are going to get better, and then in the end they're just trying
they
to scam
definitely
you.
do not care of patients, because how come you are the patient and they tell you we need to see a stool sample to discharge you, but then they give you medicine that constipates you?
Yeah,
they
because
don't
they
to
want
discharge
you. The scam is that, like, the longest you get admitted,
there.
the more money they can make of you.
Exactly.
So if they wanted me to stay there for a third day, like for another day, and for another day, and so they
It's so
keep giving me
sad.
medicine so I can stay there, and they don't discharge.
It's so sad to think that they have so much power because they can give you a medicine that can makes you feel worse. Imagine if they do that.
Yeah.
So they have been scamming hard-working Filipino people that have HMO day one, but then suddenly they cannot use it in their hospitals for X or Y excuse that they come up with. Thanks God and the universe and everything that in the end they accepted that our HMO was going to send it, the LOA. So I'm glad that our agent communicated with their boss,
Yeah.
and we were free to go.
Yeah.
But I immediately, I mean, as soon as I saw something was suspicious, I told her, the health nurse, we are not under arrest. So if you do not make this happen. I'm just walking freely out of here. Period.
And I told the lady from billing because she's like, no, because the insurance don't work. Like she's stuck on her story. So I'm like, well, my insurance is telling you that they are willing to pay you for that.
Yeah.
If you want money, communicate with them. File it through them because they will pay you. I'm not going to give you 1 peso.
Yeah. So,
So-
so it was like the hospital doesn't want money.
You don't want money? Don't call my insurance.
Because there's no way we're putting money out on this.
But yeah, guys, if that's something similar happens to you, like first thing that you need to know is that health insurance will work 24/7, okay? They
Oh,
don't
I
have,
have something to say before you give tips. They also call security.
Oh yeah, they call security on
Bear
us
in
because they
mind-
thought that we didn't want to pay. It's not that we didn't want to pay. You didn't want to call the insurance.
Bear in mind, we are not escalated, we are smiling, we are everything. But they also bring the security so you can feel intimidated. And also, with the urgency that we had, for example, or any other person has to just leave the hospital. In our case, because we are not from the city, so we have
And
to go
we
back.
have to catch a flight,
And
so we
work at
know that
night,
we
so
cannot
yeah.
stay there another day just because they want.
So they want you to be desperate and say, "Oh, it's fine."
you
I'm
know
just
what?
gonna-"
I'm just gonna pay so I can
Exactly.
go. You know.
But just going back then to tips, hold your ground, and just don't give in to whatever they are saying.
Yeah. So if that happens to you, what I was gonna say before I was rudely interrupted. If they just know health insurance don't have day off. Okay, there's not a day that they say, oh, insurance don't work today. That's not true. Oh, we are trying to call the insurance and they don't pick up. That's not true. Okay, so what you have to do is call your insurance yourself. Okay.
Yeah. Otherwise, you can also ask your manager what's the direct line the company has with the provider of
Yeah.
the HMO.
And usually, if you're working for a company that provides HMO, they send you an email when they enroll you into HMO with the contact numbers for your agent, the person that works directly from the HMO to your company. So just go back to your emails, guys, and get your number and contact your health insurance yourself, okay?
Yeah, and then you can tell them to just process the LOA for you. You can also do this beforehand. When you go to the doctor, they tell you, we're going to do this and this for you. You can, if you want to have control on what's going on, and just in case you suspect shady practices in the place, you can contact your HMO and ask for LOA letter and to be sent to your email so you can forward it to them, to admissions or billings.
Yeah. So yeah, those are ways that you can help identify the scam and also not fall for it. And yeah, guys, as Luna said, hold your ground, don't give in, don't feel pressure.
Don't feel
Okay.
threatened by
Don't-
security or any other person.
Don't lose your cool. Like keep your cool, keep calm, because if they see that you are breaking and that you started crying and that you're worried, then they know they got you.
Yeah.
And they will, pressure you even more.
So just know that you have rights. You have your HMO in your corner. They will do whatever it takes to help you out. And that's pretty much it, guys. Don't let yourself be scammed by hospitals with their exorbitant fee that they want to charge you in cash.
Yeah.
And that's why I see whenever there's someone sick, I see people in social media asking for money. And I saw in result of these shady hospitals. I'm not saying all the hospitals in the Philippines are like this. Of course not, because this is the first time this ever happens to
Yeah.
us. And it's not the first time we go to a hospital, right?
Yeah.
But I have seen so many cases now that I feel bad, and we wanted to speak up about it. So you guys, please stay safe, be vigilant for red flags wherever you avail any hospital services.
Well, and if you watch until here, please comment with a nurse emoji.
That's right.
Let's break the tension, guys. That way, people in the comments will be wondering why there's so many nurses. Well, it's obvious in this case, but yeah.
But we will like all the comments with the nurse emoji. So if you want to call our attention, that's a good way to do it.
Yeah. Thank you again for watching this video, and thank you to our patrons and supporters. Thank you so much to all our patrons: Emilio Taveras, Val Jung, Val Mike, Andrew Chica, David Sanz, Fred Gabriel, and Melchior Melken. Also, shout out to our verified Soul Lunatics: Brian Cabusora, Tish21, Darth Invader, Don Rotopuso, Ube Jalilla, Archie, Lazy Bear, Alfredo Cusson, and Jam. And of course, we are very grateful for our certified Soul Lunatics. Thank you so much for your continued support. When one video ends, you just have to watch another one.
It's called binge watching.
So go ahead.
We support you.